Hi everyone, this is Dr. Praveen here. Today I am here with two RUT test kit. See, when you look into these two tests, so see, this is the test kit, Rapid Urease Test kit, which is performed to identify the presence of H. pylori. It's an indirect method of performing the H. pylori infection in the stomach. So here I'd like to show the two kit, okay, in which whenever it turn to pink is said to be positive. If it remains like a yellow, it is negative. So when you look into these two, both looks almost negative, but this one looks somewhat pinkish, but surprisingly it has no tissue in it. This one has the tissue, I'll show later. So I'm not saying this is a defect from the kit, so it's a faulty technique. Our technician has put the distilled water which has previously opened and kept. So soon after putting the distilled water, some amount of color change has observed in this, and we have discarded this. So for the confirmation, you can see there is no tissue in it. Here you can see the color, there is no tissue in it. Okay, and this is the one which has very slight discoloration, okay, which seems to be weak positive. Okay, and here you can see it has a tissue. We have placed a tissue here. Here you can see it has the tissue, the stomach and the tissue from the corpus and pylorus. Okay, so almost half an hour over. So I have made this, I have wanted to inform or show how the small things also play a major role in determining the H. pylori. Hope even this video has become useful for you. Thanks for watching.